that, Joyce explained who I am. I practice ophthalmology most of the time, but just like Dr. Collantes, I have a passion this time for low vision. Nung pagka-graduate ko from ophthalmology dito, hindi ko pa masyadong alam yung low vision eh. Pagpunta ko na lang for subspecialty, dun ko nalaman how important the subspecialty is. Why? Because we don't stop after taking care of the eye, and you have to go on and help the patient function better, which to me, ang pinaka-importante sa lahat. And that's why I am passionate about this subspecialty. I'd like to thank the Philippine Blind Union for inviting me here, and congratulations to this event. So, Doc, I also would like ophthalmologists para malaman lang kung ang labo ng mata nila is dahil sa salamin. Kasi kung ganon, hindi na sila visually impaired. Tapos, another cause, the second cause, and very relevant or very common here is katarata. So, ano ba talagang katarata? Ang katarata ay ang pag-iidad ng lente ng mata natin. So, habang bata tayo, yung lente natin ay clear, parang tumitingin ka sa clear glass or clear window. Pero habang tumatanda tayo, nag-iiba ang kulay ng lente na to. Nagiging medyo yellow, tapos brown. So tuloy, parang tumitingin ka sa maduming window. Kaya siya maulap. Ang katarata, pag tinanggal at wala ng ibang sakit sa mata, kung katarata lang, makakakita ang isang tao. But kung may ibang sakit sa mata, kahit tinanggal yung katarata, malabo pa rin. So, tinatanggal usually ang katarata kung nahihirapan gumawa ng mga gusto nilang gawin yung pasyente. So, cataract surgery is is done by all ophthalmologists, and this is routine. And everybody does it. So, another important cause of low vision is diabetic retinopathy. So, ano ba talaga yan? Ang diabetes kasi develops when our pancreas cannot produce enough insulin na kailangan na nagpo-process ng sugar. Kailangan ng katawan natin yung sugar eh. So, ang nangyayari is pag yung sugar is in the blood vessels sa ating mga ugat, ito, nasisira yung mga blood vessels na to. So, pag may diabetes ka, apektado ang buong, lahat ng katawan mo. So, ang kidneys natin are involved, and sometimes yung iba napuputulan ng paa. But sa mata, ang involved is ang retina. Ang retina is yung nasa likod ng mata na nandun lahat ng mga ugat ng mata natin na very important. So, may dalawang stages ang diabetes, diabetic retinopathy. Ang una is background or non-proliferative. Ibig sabihin, meron lang konting mga pamamagat, konting mga hemorrhage, konti lang na at this point, wala tayong magagawa kundi diet, exercise, and the most important is to take your medicines and to control your blood sugar. Dapat laging pumupunta sa diabetic doctor. Ang pangalawang later stage is ang proliferative diabetic retinopathy. Dito, ang nangyayari is bumubuo na ng mga bagong blood vessels or new blood vessels. At itong mga bagong blood vessels na to is very fragile. Putok siya ng putok. After a while, pag walang ginawa dito, pwedeng mabulag yung pasyente. And when you get to this stage, nilalaser ng doktor or retina specialist ang mata ninyo para lang hindi lumala. Pero once nasira na yung ibang parte ng retina ninyo, hindi na maibabalik yung mga parts na yon. So it is very important and key that when you have diabetes, dapat laging pumunta sa eye doctor at sabihin sa ophthalmologist na meron kayong diabetes para mabantayan ng mata ang mga mata ninyo. And this has to be done regularly and forever, just like seeing your own diabetic doctor. Okay, now, so ang diabetic retinopathy ay nakakabulag. The next is the next causing visual impairment is glaucoma. And na-explain ni Dr. Collantes sa inyo yung glaucoma. Kasi sa glaucoma, ang namamatay is yung optic nerve. Ang optic nerve is the main nerve of the eye. Pag patay ang optic nerve, walang makikita. So paano to nangyayari? May kanal tayo sa mata natin to drain, para ma-drain yung tubig na napoproduce ng mata natin. Pag may glaucoma, may depekto itong kanal na to. So hindi niya ngayon ilalabas yung tubig sa mata, so tumataas yung presyon, at habang mataas ang presyon at hindi natin alam, namamatay unti-unti ang nerve. So ang unang nawawala is ang side vision, peripheral vision nawawala. And then minsan pag nawawala yung side vision, hindi pa natin alam na may glaucoma kasi clear pa yung central vision natin. But once it gets magpo-progress siya, lumiliit yung paningin hanggang nagiging tunnel vision na lang, hanggang pwede maging blind. Ang dami-daming mga magagaling na gamot ngayon that will help with the pressure, or there's laser or surgery. And the most important with glaucoma is prevention. Early detection so that mapaprevent natin from getting blind, because glaucoma is blinding. Another cause of low vision is macular degeneration. Dito naman, ang damage is macula, which is the central part. It's the part ng retina na in charge sa central and detailed vision. Ngayon, itong central and detailed vision, the central or detailed vision is impaired, and so ang nangyayari dito is hindi nyo nakikita yung face ng tao, or you don't recognize the person, at mahirap magbasa ng mga small print, no? So macular degeneration can be inherited, at saka may but most of the time it is age related. Hindi lahat ng umiidad nagkaka-macular degeneration, but hindi natin alam kung bakit yung iba nagkakaroon ng macular degeneration. But they say na may mga risk factors, yung sun exposure sa sun, or smoking, or hypertension. So this one doesn't proceed to blindness kasi may naiiwan na peripheral vision. So ngayon, yung mga treatment options for macular degeneration are injections that are very expensive. But these injections will prevent it from getting worse para hindi lang lumala, but hindi siya gumaganda yung paningin, and they are very, very expensive. So another one is retinitis pigmentosa. Alam ko marami ditong may retinitis pigmentosa sa Pilipinas. Dito, namamatay kasi yung mga photoreceptors ng retina that is responsible for seeing in the dark and seeing in the periphery. So yun yung nawawala. Yung unang nawawala is yung peripheral vision or side vision, and then progressive ito hanggang nawala yung central vision. So retinitis pigmentosa is also blinding, pero iba-iba yung progression. May mga iba, mabagal ang progression, yung iba, hindi naman. So this one is also genetics, and the most common first sign is night blindness. Kung nakikita nyo yung mga anak nyo na nababangga sa dilim, kailangan patignan. This is also hereditary, so pag may retinitis pigmentosa kayo, dapat ma-check yung mga family members. And punta kayo kay Dr. Colyantes kasi gene therapy, okay? Until today, wala pang treatment, unfortunately, para sa retinitis pigmentosa. But the gene therapy is being studied, and maraming mga research that is done for retinitis. So that is a good thing. For night blindness, kailangan lang magdala ng wide beam flashlight para hindi magka-aksidente sa gabi. So also recently in some researches, meron silang electrode or implant na nilalagay sa ilalim ng retina, tapos nakakonect siya sa isang Bluetooth na glasses. So yung mga walang nakikita, as in no light perception, yung mga blind, nakakakita ng mga shadows. And with those shadows, mas lakad sila mag-isa. But this is still an experiment, and they're experimenting on the blind eye only. And now they're also studying to put the implant into the brain. Pero lahat ito is all under experiment, and it's very but it's very exciting because marami ng mga treatments that are being researched. So another cause is amblyopia, or ang tinatawag na lazy eye. Nangyayari ito kapag ang isang mata ay nakakakita, but yung isang mata hindi nakakakita dahil may grado or na hindi natin alam. So ang nangyayari is yung bata na yon ay ginagamit lang niya yung matang hindi malabo. In the end, kung hindi naagapan yung matang malabo, tinatamad na yon, hindi na siya natututong makakita. So it's important for young children to always have an eye checkup para maiwasan ito. Pag may bata na visually impaired, maraming magagawa sa classroom. There are tips for teachers to make the classroom more accessible. And if there are teachers here who are interested in those tips, they can just email me and I can email them back some strategies in the classroom. My email is carmelaMB@gmail.com. So other causes of low vision are mga damage sa brain like stroke or trauma and the like. So anyway, the good news is meron tayong mga devices that can help a person go back to what you want to do with low vision. So we start first with, ang alam ng lahat is magnifiers. Ang magnifiers can be handheld or stand. So ang magnifier is usually lighted para lumalaki. The purpose of a magnifier is para lumaki yung nakikita sa yung binabasa. Maraming powers ang magnification. So the bigger the screen, the magnifier lens, the lower the magnification. Habang lumiliit, mas tumataas ang magnification. So, the smaller it is, that means mga 7 times na to. So, karamihan ng patients sasabihin nila, ay, hindi naman gumagana yung mga magnifier sa akin. Pagtingin ko sa magnifier nila, ang laki. So, malaking magnifier, siguro minamagnify lang ng 1 to 2 times. So, it's really important to know kung ano yung magnification ninyo so that malaman which is the proper magnification na gagamitin ninyo. So, this is a handheld magnifier na kailangan isa-steady mo with a certain position para mabasa mo yung material. We also have a stand magnifier, pero wala akong sample na ilalagay mo lang, itatapat mo lang sa page, and then ilalapit mo lang yung ulo. Kaya lang mas bulky yon. Those are all affordable and they're all available here in the Philippines. There are also magnifiers na, Doc, hindi ba pwede yung hands-free? Meron tayo yung mga head-borne magnifiers, kaso mababa lang yung magnification nito. So, hindi masyadong nagagamit ng mga may visual impairment na medyo grabe. Ngayon, for distance, we have telescopes. Ang telescopes, monocular, binocular, ginagamit ng mga bata sa school. Or else, if you want to read signs, hindi ka naman pwedeng punta maglakad na naka-telescope. However, may mga bagong telescope ngayon na on top of the glasses. So, ang nangyayari is you wear it and then you walk around looking through the lens. Tapos, kung gusto mo makakita with the telescope, ibababa mo lang yung ulo and makikita mo na yung telescope, yung signs or whatever you want to see sa malayo. These are called biopic telescopes. But these are expensive, but they're very helpful, they're very light. For people who are very visually impaired and there is, they hindi kaya ng mga ordinary magnifiers, we have the video magnification. The nice part about the video magnification is hanggang lumalaki yung print, and then pwede mong palitan yung color. So you can make it bigger color. So may contrast dito. Ang maganda rin dito sa layers is the print is really very readable. And this comes in different sizes. May mas maliit, may parang smaller magnifiers, digital magnifiers. Usually mga estudyante gusto nila ito. And there are also mga connecting to a laptop or a desktop video magnifier. Those are very expensive nga lang. Tapos, okay, but in this, tapos yung iba, pag pinapakita ko itong device na to, which is the digital one, tatanungin nila, Doktora, hindi ba pwedeng may ganyan na nasa eyeglasses, di ba? Usually yan yung gusto ng patient. Meron na rin silang na invento na ganyan. It's called the iris vision, para siyang, or else the e-sight, para siyang naka-virtual reality lang. Pangit yung itsura at saka sobrang mahal. In the end, most of the time, ayaw gamitin ng pasyente dito sa Pilipinas yung mga ganyan. But it's also very expensive. But in this day of age and technology, it's easier for visually impaired people to function without gadgets kasi may accessibility na ang smartphone, computers, tablets, and these accessibility features can help allow people with visual impairments to work again. That's why in Atrieve, they use some screen readers. Once you know how to, so yung mga taong nawala ng trabaho because of this pandemic, the best talaga is online. And you can learn how to use the computer by going to Atrieve. They'll teach you how to use it. Tapos, makaka-business na kayo na online, which is moda na ngayon, di ba? There's also the ORCAM, which I believe, I don't know kung nandito si Ramir. Ang ORCAM is more for the visually for the profound visual impairment or almost blind, na magnetic strip siya na naka-attach sa glasses. Whatever you point to, it's very light. Whatever you point to, babasahin niya yung pinoint mo na page. However, again, it's available dito sa Philippines, pero it's very, very mahal. So there are other tips to cope up with visual impairment, which include large print books, and then may mga talking wristwatches or whatever. But really, the first technique is to just go closer. Example, kung gusto niyo manood ng TV, lapit lang kayo. The bigger the TV, the better. Another is to do eccentric viewing for mga people na may natitirang vision sa gilid. Ginagamit yung gilid na vision para mas nakakakita. So you don't look straight, but you look to the place na kung saan mas nakakakita ka to where you can see better. Another is to scan for people na may tunnel vision na lang. Kailangan talagang i-move yung head para makita kung meron ba silang mababangga or hindi. Another is light. The most important that people forget is really light, and the right amount of light is important. To read small print, maganda yung light na, or even while you're eating, yung light na a gooseneck lamp na pwedeng mas malapit siya sa papel kaysa sa mukha, that will really make it easier to read. Also, contrast. Example, contrast is important. Example, pag puti yung plato, tapos yung kanin mo puti, mahirap din makita yon. Baguhin nyo yung kulay para mas nakikita nyo. Ito yung kanin, ito yung ulam. And then, you need some organization and safety tips sa bahay para everybody can do well sa bahay. Then we also have filters, usually yellow or amber filters. This one protects from glare but enhances the contrast. So these are also available. So magnification or making things, in the end, it's really about making things bigger, bolder, and brighter. So for people with visual impairment, in conclusion, for people with visual impairment, don't lose hope. There's always a way to cope with whatever vision you have left. Or nowadays, even for the blind, there's so many ways of how you can go around and have a life that you want to live.